Hi, I'm going to share today 10 warning signs that it could be a lung cancer. People come in all the time coughing and they might be coughing for 2 or 3 weeks. And sometimes they don't know why the cough is. And so today, like I said, I'm going to share 10 warning signs whether it could be a lung cancer. Number one is if a cough doesn't go away. So a cough that lasts up to 2 to 3 weeks is a warning sign to check out whether it's a lung cancer, especially if the person is coughing up blood. So I know we get coughing from flu and cold, and that's common, or from normal respiratory infection. But a situation where you have had your treatment, you've had your antibiotics, is no more respiratory infection or viral infection or cold, and you're still coughing, especially when you're not a smoker, then that cough could be a lung cancer. Number two is your voice. Does your voice crack and go hoarse or go deeper than normal? Then that could be also a lung cancer. So we know how we all sound. You know how you sound. So if your voice starts cracking and it doesn't, no matter how much you clear your throat, no matter how much you try, and people might tell you, hang on, what's wrong with your voice? You seem to be sounding off. Then that could be a lung cancer. You need to get that checked out. Number three is unexplained weight loss. You see, when you start losing weight, when you haven't done anything, you haven't tried, it's not that you're cutting what you're eating. In fact, you're eating more and you don't seem to be able to put that weight on. That could also be a sign of lung cancer. The fourth one is shortness of breath or wheezing. I know people who are asthmatic or who have some chest infection or who suffer from what we call COPD. Sometimes they can wheeze, they can feel breathless. That is normal. That is a sign of asthma. But what happens when you're not asthmatic or when you're not suffering from COPD and all of a sudden you're wheezing, you're struggling to breathe, and you cannot tie it down to anything, it's not an allergy, then that kind of difficulty in breathing or wheezing needs to be checked out. Number five is change in your normal cough. I know, like I mentioned earlier on, smokers have what we call smoker's cough. It's common with those who smoke. They cough all the time. It's normal because they know they smoke, they know why the cough is. But if you're not a smoker and you're having this hacking, persistent cough, and it's not your medication. I know some medication can trigger cough. There are some antidepressant, anti-high blood pressure medication which can cause cough. If that cough has nothing to do with smoking, it has nothing to do with medication you're taking, then that could be a sign of lung cancer. Number six is aches and pain when you're breathing or coughing. So when you're having difficulty in breathing or when you are coughing, does it hurt? Does your chest hurt? Do you feel aches and pain around the lungs area or your chest area? Then that could also be a sign of lung cancer. Another number seven is persistent tiredness or lack of energy. Maybe you are the type that has always been strong and active and buoyant. You're always on the go. And all of a sudden, you're feeling so tired. Maybe initially you think, oh, I haven't had a good night's sleep. But you have had a good night's sleep. You have rested, but you're still feeling tired. Maybe you used to take a long walk. All of a sudden, you walk 10-15 minutes, you get tired, and you have lack of energy. You've tried everything, and you're still suffering from lack of energy. That could be a sign of lung cancer. Number 8 is difficulty in swallowing. So when you want to swallow anything, when you eat and you're having difficulty in swallowing, what we call dysphagia, or when it's painful when you swallow, that could also be a sign of lung cancer. So that needs to be checked out. See, why I'm mentioning all this is that these days cancer kills not because a lot of advancement has been made, a lot of progress has been made in managing and combating cancer. Unfortunately, there is no cure. But the truth is that if you're having any sign, the early detection of those signs will give that person a better chance of survival. Go back to the points. Number 9 is swelling on your face or your neck. So if you're having an unusual swelling on the neck or your face, it's not a boil, it's not, again, a standard infection. You have not gone into a fight, or you haven't fallen or had a physical injury, then that could be, it's also swelling that you could not determine where it's coming from, then that could be a sign of lung cancer. That needs to be checked out. And finally, before I mention number 10, I'm going to ask, have you subscribed? Please hit that subscribe button and subscribe. And also, check out all my videos I have released. I've mentioned so many topics. I've talked about heart attack. I've talked about losing weight. I've talked about so many lupus. So please check my videos, subscribe, and also share this particular video, because some people will find it a life-saving opportunity to know these points. Back to the point. The final point, number 10 point, is persistent chest or shoulder pain. See, when you're having chest pain or shoulder pain, you need to find out what it is. If you haven't been involved in any physical sport, or you haven't had a physical injury, or maybe you can't really determine what it is. Sometimes shoulder pain or chest pain could be nothing. Maybe you can take some painkillers, but you have taken that painkiller for shoulder pain for weeks on end and is not touching it. It is a time to see your doctor, to do some tests, to check out, to make sure it is not a sign of lung cancer. So those are the 10 points. I hope you've got it. Thank you for watching, and I'll see you some other time. Thank you and goodbye.